Epidemic disease always tells us that. You know, it's not three worlds, one world, second world, third world, it's one world. A lot of discussion I've heard has been about cultural practices and beliefs of other people, but it's our cultural practices and beliefs also. You know, how do we focus on real development and development of health systems that can be sustained over time? How do you have a proper health system that reaches from a rural community near a jungle, for example, into a town where there's a clinic and into a hospital? It's a hard thing to do. Four things we need. We need staff, we need stuff, we need space, meaning safe space to do this work, and systems. And then the most important thing, I think, is to understand that building local capacity in places where these problems happen, that takes many years, not one or two. So the emergency response approach is not the one that can get us out of the current predicament. It's got to link that emergency response to long-term capacity building. The current outbreak of Ebola should be treated as an opportunity to really invest the right way. I can't imagine any real development happening without a sound health system and a sound educational system. And it's hard to have public health if you don't have a public health system. We're using an old way of thinking, like this is our nation, that's another nation, that's their problem, this is our problem. It's everybody's problem.